Hello, hello, hello. Thanks for joining me. I'm Dr. Sam Price. I'm a licensed naturopathic physician. That means I'm an expert in natural medicine. Through my #1 best-selling books, my concierge medical practice, my live event Vital, The Experience, which this year we're going to have in Playa del Carmen, September the 18th, 19th, and 20th. Please ask me about that later. I help you to bridge conventional and alternative medicine to transform your illness into wellness. And today we're going to talk about diabetes. So it's kind of going to be off the cuff, not really scripted. I have some things I want to teach you guys. So it is National Diabetes Awareness Month. That is November. There are other things that happen in November, but for today we're going to focus on diabetes. My love for endocrinology started when I was in medical school, specifically with Dr. Mona Morstein at Southwest College of Naturopathic Medicine. I always thought that my practice would be full of nothing but patients with diabetes, so I definitely have a heart for endocrinology. So with that being said, I kind of wanted to explain to you guys what is type 1, what is type 2, what we can do about it, okay? So if that's okay with you guys, I'm going to share. If you have questions, answer them as we go along, or if I don't get to them, I will, after the broadcast, actually answer them for you. So I want you to understand that type 1 diabetes is different from type 2 diabetes. So type 1 diabetes means that your pancreas, which is an organ inside your body that actually produces insulin, in type 1 is not functioning. It's not producing the hormone called insulin. And that is why type 1 diabetics must take insulin. Must take. There is not anything natural that we can give you that will replace it. That's number 1. Type 2 diabetes means that either the receptor cells for the insulin on our red blood cells is not working properly, or the insulin's not coming out effectively, or it's not triggering our glucose effectively. It doesn't mean it's different from type 1 in the fact that the pancreas is still secreting insulin, okay? So that's the distinction between type 1 and type 2. Also, type 1 used to be called juvenile diabetes because you're born with it. We now know that that's not necessarily true, that type 2 can actually go into type 1, meaning you're not regulating your sugar levels properly, you're not eating or exercising or doing what the doctor's asking you to do, and you're type 2 diabetic, it can actually go into type 1, which means that your pancreas was secreting the insulin, and now because you haven't properly managed it, it's now type 1, and it no longer produces insulin. I hope that makes sense. Okay, now that we've talked about the difference between type 1 and type 2, I also want you guys to know that type 2 is avoidable. If your doctor is doing regular lab work on you, and I always suggest that lab work is done every 3 months, that's because every 90 days or 3 months, your cells recycle, okay? And a lot of times we're doing stuff like insulin, our glucose, and hemoglobin A1C. Those are the labs that we're looking for. So please ask your doctor to do that. Every 3 months you want your hemoglobin A1C. And this is actually testing sugar cells that are located on your red blood cells. They just kind of like clump up like little heart little things. It's called glycosylation. So that's what we're looking at. You can't cheat at this. So when we're actually measuring diabetic patients and they're like, oh my God, I gotta go to the doctor in the next week or 2. Let me cut out this sugar and let me not eat this pizza or whatnot. You can't cheat with that because it's measuring it over a 3-month period. Okay, so hemoglobin A1C is one of my go-tos, insulin and glucose. That's what we're looking for. What I wanted to tell you guys is that 1, diet is super, super duper effective for preventing diabetes. And also, let me explain. As you guys know, I did my residency with Peter D'Adamo. He's the author of Eat Right for Your Blood Type. But he also has a book called Diabetes. It's from the Blood Type for Battle Plans series, and it's a diabetes book. I know this is backwards, but I wanted to read you guys a little something so that I make sure that I get it right. So, as you know, blood type A, blood type B, AB, and O are quite different. And if you're eating correctly for your blood type, this is, to me, a genetic-based diet. to eat, and it should be the foundation of the way in which you eat. You can add on top of that, you can be a blood type A and say I'm vegetarian or vegan. You can do keto if you're blood type O. You can add on to that your different dietary restrictions or pescatarian or whatever you want to do, but the basis of whatever you're doing should, to me, in my opinion, be blood type diet. So I wanted to read a little bit out of specifically the diabetes book, and then we'll talk about some vitamins and some minerals that you can do if you have diabetes, have a loved one with diabetes, suffering with diabetes, or want to prevent it for that matter. I wanted to read you about blood type A and AB, and then O and B as far as diabetes and your diet is concerned. So it says, type 2 diabetes has a different set of risk factors. Blood type A, and to a lesser extent, blood type AB, genetically favors a diet that is low in animal protein and high in complex carbohydrates and high quality vegetable protein such as soy. So as you know, I always tell everybody, if you're vegan, it doesn't mean that you can't have any meat, but you should definitely be avoiding it as much as possible. These blood types lack the digestive enzyme, which we all understand as hydrochloric acid, to properly metabolize fat and high protein. So that in itself lets you know that you can't do a keto diet if you are blood type A or AB. It just is really not a good thing for you. When blood types A and AB overconsume meat, it increases their overall cholesterol and their LDL cholesterol to have blood that clots more readily. These factors give blood type A and AB diabetics a greater risk of developing cardiovascular and atrial complications due to diabetes. So if you have diabetes, I want you to really pay attention to your cardiovascular health, because making sure that you're not over consuming meat and carbohydrates and high fats, this will help to manage your cardiovascular issues. Then I wanted to read to you about blood type O and B when it talks about this. So carbohydrate intolerance is the main pathway to diabetes for blood types O and B. If you know your blood type is B or O and you're trying to prevent diabetes, you want to avoid carbohydrates at all extents. So if you have a family history, like your aunt, your mom, your dad, somebody in your family has diabetes, and you're really scared of developing it, and you know that you're a blood type O or B, my suggestion is that you follow the blood type diet, and this means avoiding, like the plague, our legumes. So in this respect, they are the opposite of blood types A and AB. Since they are unable to fully digest many carbohydrate foods, particularly grains and beans, these foods are converted to fat, okay? They're converted to fat when you eat them because we can't properly digest them. So that, I think that's all I wanted to read. Yes. Okay. In other words, insulin resistance caused by carbohydrate intolerance leads to high triglycerides. Specifically, those are my words of wisdom specifically about blood type diet as it relates to diabetes for patients. I also today wanted to give you guys a little clinical pearls about the vitamins and the minerals that we use in naturopathic medicine specifically for diabetes. So most people, well, not most people, a lot of diabetics, specifically if you're type 2, are on something called metformin. Now, depending upon the dose, a lot of times metformin can cause diarrhea. And this is a common complaint that I hear of my patients that are on metformin. Well, if you're in place of the metformin, you can ask your doctor to cut the dose back. And also, I want you guys to understand that when you're having diarrhea, or if you throw up or diarrhea, or you're constantly going to the bathroom, that also helps it makes you dehydrated. So you have to hydrate afterwards. So those of you who are on metformin and having diarrhea, 1, that shouldn't really be happening, and your dosage needs to be monitored by your doctor. So please talk to your doctor. 2, while you're having diarrhea, please make sure that you're replacing your electrolytes. So that's because it does dehydrate you, and this could cause cramping and fatigue and other things that we don't want. So make sure that you're replacing your electrolytes, but you shouldn't be having diarrhea. Okay, so ask the doctor to readjust the dosage. The vitamins that I wanted to tell you guys about are B3 and B6 specifically. So B3 is called niacin, and is the precursor of glucose tolerance factor. So it's going to help you actually receive the glucose, which is sugar, and actually drive it into the cells the way that we properly use it to make energy, instead of it just floating around, okay? B6 prevents tissue glycosylation. So glycosylation is, remember, like if you think about on a creme brulee, when you've got sugar on the top and you're burning it, that little crystallized stuff, that's like glycosylation. So that would be the sugar on your cell. So it actually prevents that from happening. And that's what we're testing when we're looking at hemoglobin A1C. So please make sure that you're taking at least a B6 and a B3 if you have diabetes. Also, metformin depletes B12 levels, so a B12 would be a really good idea for you to take if you are on that drug specifically. Vitamin C, vitamin D, and vitamin E are the other ones. I'm not going to go into detail about those, but those are really some good vitamins for you to have. So a good multivitamin would be a great idea for you, but make sure that it's heavy on the B6 and B3 side. The minerals. I think that these are really overlooked, and I want to play them up a little bit. So chromium is a cofactor for glucose tolerance and production. Magnesium. I have a lot of diabetic patients that talk about cramps and things like that. Magnesium is a fantastic cofactor and mineral. So it says it helps B6. So remember, I just talked about B6. It helps B6 get inside the cells, and it prevents retinopathy. So there's a couple of different things that we know of that happen as a like a side effect of having diabetes, and this is why you always need to go see your optometrist, your ophthalmologist, to get your eyes checked. So retinopathy is an eye disorder. Also, your feet, a proper thing for you to do constantly on a regular basis. And neuropathy is like that tingling feeling, or like your hands, your toes go numb. So it helps to prevent retinopathy. That's magnesium. Vanadium also improves glucose tolerance, so the tolerance of the sugar. And then zinc, it's part of insulin synthesis, so it helps to increase the production of insulin and secretion and the utilization of insulin. Insulin is the hormone that drives glucose inside the cell, okay? So those are the minerals: chromium, magnesium, vanadium, and zinc. And the vitamins that I told you about are B3, that's niacin, B6, C, D, and E. Those are the ones that I wanted to tell you guys about. Did I want to tell you about anything else? I don't think so. So it's interesting. I can tell you guys a little bit about some vitamins and minerals and things like that, but honestly, the way I practice medicine is so individualized. I need to get to know you. I want to see lab work, so I'll give you a little something, but I really want to get to know you, and I need to know your lab work and your story in order for me to prescribe the best thing possible for you. But I will tell you this. I've seen lives changed, and I've seen diabetes type 2 actually reversed when you're actually managing your diabetes correctly. When you're managing your diet correctly. Diet and exercise are so crucial when it comes to diabetes. So I hope this has been informative. I'm Dr. Sam Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. Through my #1 best-selling books, my content, Vital the Experience, I help you to bridge conventional and alternative medicine to transform your illness into wellness. Thanks so much for joining me. Please go to my website at www.drsamnd.com. That's DRSAMM. N is in naturopathic, D is in doctor.com. Go to the events page and you can book right now to go to Vital the Experience. I look forward to seeing you. Bye.